We provide health care, primary medical, general dentistry, counseling to the low-income working uninsured. We are not a free clinic. We operate on a sliding fee scale. The majority of our patients pay 10% of what it would cost in the private sector. Every community benefits from the community taking care of the less fortunate in that community, stepping to the plate, being the helping hand, the hand up, not the handout. But I think it's important because we serve the low-income working uninsured, and we need to keep people working, not just because it's the right thing to do, but it's the right thing to do from an economic standpoint. It's the right thing to do in every aspect. We've got to keep people healthy enough to take care of their children, healthy enough to get up and go to work, and healthy enough to be contributing members of our community. Well, you know, every chronic disease manifests itself different, and every individual reacts in a different time frame. You take someone with heart disease that is not going to the doctor, is not getting the appropriate diagnostic testing so the doctor knows how to appropriately treat that individual. You take all of that into play, it can lead to the most severe of all, death. But it might even lead to being disabled, to where they can't work and they can't support their family any longer. So not only is it the emotional toll and the physical toll, but it's also the mental toll of knowing that their family no longer has their needs met. The same thing with another chronic disease like diabetes. It might start out that you're just more lethargic. Maybe you can't work as many hours. It might start out that then you get neuropathy, to where your feet hurt and you can't do a job that you stand on your feet, or you can't go outside and play with your children. All of those things manifest itself differently with each of the chronic diseases that we're aware of, but the outcome is the same. If we don't give people an opportunity to get well, they cannot live the life that they need to live, much less a life they want to live. I don't think people really get that they can come to InterFaith Health Clinic and that it is on a sliding fee scale, and that, you know, nobody's going to hound them about their money. Unfortunately, they've been told no. Sometimes in the private sector because they didn't have health insurance, so they don't reach out to us because they expect to be told no again. And there's just so many times you can be told no. Another barrier is, I do think that our patients struggle sometimes with their work schedules because they don't always work a traditional 8-to-5 job. And so we're very fortunate to be open to 8 o'clock at night, several nights each week. So I think that we're trying to ease that barrier that way. But I also just think there are so many things like how to eat healthy. It costs money to eat healthy. There's just a lot of barriers out there to promoting health that we're all still struggling to meet. But we're doing everything we can at InterFaith to at least provide access to that health care.